Well, Ron, we're talking about superbugs with a superbug expert. We have Dr. Eddie Stenhjem here from Intermountain Medical Center. And Intermountain just got a big grant to look at smaller hospitals in the state to check out how, antibiotics are working or how superbugs are spreading.
Right. Really what we're trying to do is we're trying to look in the small hospitals to see how well we're utilizing antibiotics and what can we do to actually improve that.
Are we overusing them?
We don't know yet.
Okay.
Most of this focus has been focused on large academic hospitals like Intermountain Medical Center, LDS, University of Utah. So this is really the first time that we're going into the community and looking at these smaller hospitals and really trying to evaluate what we can do to optimize use.
Okay, now this is a big deal to Intermountain to be doing this, but what does it mean to my neighbor?
Right.
I mean, it's really going to affect our lives if you discover things that will help us.
Right. Really, the importance is that we're not only bringing programs to optimize use to these smaller hospitals, but we're also looking at what are the best ways to do it. And so going forward, Intermountain will have a model that we can use in all our small hospitals, and also we can use it within the United States because we can serve as a model program that we can distribute.
Okay, and is it on like cleanliness and different procedures that hospital workers can follow or that patients and visitors can do?
So most of this is actually working with pharmacy and physicians to try to better optimize the use of antibiotics. We know that between 30 and 50% of antibiotic use in the community and in the hospital is what we deem inappropriate, either too long a therapy, too broad a therapy, or unnecessary. And so what we're trying to do is reduce some of that inappropriateness and really optimize the use so we can better clinical outcomes. And so most of that is focused on physicians and pharmacists.
And I mentioned my mother-in-law got MRSA several years ago, and she was in the hospital for 3 months. It's an antibiotic-resistant bug, and you guys are trying to put an end to that.
What we're seeing nationally is higher rates of resistance in all sorts of bacteria, one of them including MRSA or MRSA. And so what we do is we look at different risk factors for those types of infections. One of the biggest risk factors is prior antibiotic use. And so if we can minimize some of that antibiotic use, that unnecessary use, we hope to be able to reduce some of that multi-drug resistant bacteria.
Well, big deal to get this grant. We hope it works great, and glad that Utah can be part of it.
Absolutely.
Thanks so much, Dr. Stenhjem, and we'll take a break and be right back.